Oxacillin Sodium Vial is a medication used to treat various bacterial infections. It belongs to the penicillin class of antibiotics and works by inhibiting the growth of bacteria. This medication is typically administered by injection into a vein or muscle. It is important to follow the dosage instructions provided by your healthcare provider. The timing of the doses is also crucial for the medication to be effective, so be sure to take it at the recommended times throughout the day. Always consult with your doctor for the best course of treatment for your specific condition. When using Oxacillin Sodium Vial, it is typically given through injection into a vein or muscle every 4 to 6 hours as prescribed by your doctor. The dosage will depend on your medical condition and how you respond to the treatment. For children, the dosage is also based on their weight. If you are using this medication at home, it's important to learn the preparation and usage instructions from your healthcare professional. Before using, check the product for any particles or discoloration. If you notice either of these, do not use the liquid. Make sure to also learn how to store and dispose of medical supplies safely. If you are using the frozen pre-mixed solution, thaw the container at room temperature or in the refrigerator. If thawed in the refrigerator, let it sit at room temperature for at least 1 hour before using. Do not thaw using warm/hot water or microwaving. After thawing, shake well and squeeze the container to check for leaks. Discard if the container leaks. Do not refreeze the solution after thawing. For best results, use this antibiotic at evenly spaced times and try to take it at the same times every day. It's important to continue using this medication for the full time prescribed, even if your symptoms improve after a few days. Stopping the medication too early may result in the return of the infection. If your condition lasts or gets worse, make sure to inform your doctor. If you experience pain, redness, or swelling at the injection site, inform your doctor or pharmacist. It's important to note that your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of potential side effects. Most people using this medication do not experience serious side effects. However, it's crucial to seek medical attention if you experience easy bruising or bleeding, signs of a new infection, changes in urine color or amount, swelling in the hands/ankles/feet, stomach pain, nausea/vomiting, unusual tiredness, yellowing of the eyes or skin, seizures, uncontrolled movements, or mental/mood changes. Additionally, be aware that this medication may rarely cause a severe intestinal condition. If you develop persistent diarrhea, abdominal pain, or notice blood/mucus in your stool, it's important to contact your doctor immediately. Do not use anti-diarrhea or opioid products as they may worsen symptoms. Prolonged or repeated use of this medication may result in oral thrush or a new yeast infection. Seek medical advice if you notice white patches in your mouth, changes in vaginal discharge, or any other new symptoms. While a serious allergic reaction to this drug is rare, seek immediate medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before using Oxacillin, it's important to inform your doctor or pharmacist if you have any allergies, especially to other antibiotics like penicillins and cephalosporins. This medication may contain inactive ingredients that could cause allergic reactions, so make sure to talk to your pharmacist for more details. It's also important to share your medical history with your doctor or pharmacist, especially if you have kidney or liver disease. This medication contains sodium, so if you are on a salt-restricted diet or have a condition that could be worsened by an increase in salt intake, such as heart failure or high blood pressure, consult your doctor or pharmacist. Oxacillin may also interfere with the effectiveness of live bacterial vaccines, like the typhoid vaccine. Make sure to inform your healthcare professional that you are using Oxacillin before receiving any immunizations or vaccinations. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, it's important to be aware that they may be more sensitive to the extra sodium in this medication. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, oxacillin passes into breast milk in small amounts, so consult your doctor before breastfeeding. When taking Oxacillin Sodium Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. One product that may interact with Oxacillin Sodium Vial is methotrexate. Additionally, this medication may interfere with certain lab tests, such as certain urine protein tests, which could potentially cause false test results. It's essential to make sure that all lab personnel and doctors are aware that you are using this medication. In order to ensure that Oxacillin Sodium Vial is effective and safe for you, it's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. Always consult with your healthcare provider for personalized dosing instructions and the optimal timing for taking this medication. If someone has taken too much Oxacillin Sodium Vial and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call 911 or contact the local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Symptoms of overdose may include seizures and changes in mental or emotional state, such as agitation or confusion. It's important to have lab and medical tests done while using Oxacillin Sodium Vial, including complete blood count, sodium/potassium blood levels, and kidney/liver function tests. Make sure to keep all medical and lab appointments. Make sure to take each dose of Oxacillin Sodium Vial as prescribed. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to check the product instructions or talk to your pharmacist about how to store Oxacillin Sodium Vial. Keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.